Mr. Adekunle Oluwatosin Adeluwoye, a native of Ondo State, was born on the 20th of October, 1982, in Okitipukwa. His educational journey began in his hometown of Okitipukwa with deliberate and purposeful footsteps. Mr. Adekunle found himself with a BMLS histopathology major at Ambrosali University, Ekpoma, Edo State. He acquired an MSc in biochemistry, cancer research, and molecular biology at University of Ibadan, Oyo State. While at Leeds City University, Ibadan, a PhD in molecular biology and genomics is in view. Mr. Adekunle has several professional certificates in the bag, some of which are certificates in leadership and management. In health from University of Washington, a certificate in bioinformatics, SARS-CoV-2 genomics, data analysis from Pine Biotech in collaboration with Sauber Bioinformatics Research Center, New Orleans, USA. Mr. Adekunle acquired some certificates through Coursera.org for bioinformatics, life sciences on your computer from Johns Hopkins University, Risk and Opportunity. Managing risk for development from the World Bank. Data management for clinical research from Vanderbilt University, epidemiology. The basic science of public health from the University of North Carolina at Chapel Hill, contraception. Choices, culture, and consequences from University of California, San Francisco. He also acquired a certificate in political advocacy, HIV course for Global Youth Coalition on HIV/AIDS, a program of the Public Health Institute, USA, and a certificate in fostering change in health services and M&E frameworks for HIV/AIDS, program courses from Johns Hopkins Bloomberg School of Public Health, Global Health E-Learning Center in partnership with USAID. Mr. Adekunle is an associate member, Medical Laboratory Council of Nigeria, MLSCN, a member, Omics Logic Africa, Pine Biotech, USA, as well as a member, Association of Medical Laboratory Scientists of Nigeria, AMSIN, and a member, Global Youth Coalition on HIV/AIDS. Some publications and scholarship work in his MLS field to be noted are an essay article on safety laboratory acquired infection, a major challenge in medical laboratory practice, Biomedical Quest, UCH Ibadan. As a session speaker on leadership for HIV prevention, education, Youth Pre-Summit, First Regional Education Summit on HIV and AIDS in Africa, venue, ICC Abuja, date 21 to 24 November 2011, also including numerous journal publications. At the Blood Drive Initiative Nigeria, Mr. Adekunle was co-initiator and executive director, Operation Volunteer Basis in NGO. He interned as medical laboratory scientist at University College Hospital, Ibadan. As part of his service to the nation, he was a corps member stationed at Molly Group Specialist Hospital, Idiape, Ibadan, where he worked as medical laboratory scientist / HOD laboratory department before becoming a full employee at the same hospital. After this, he took the position of medical laboratory scientist and laboratory manager at Life Care Diagnostics Laboratory, Ibadan. His next job role was at Synapse Biotech Limited, Enugu, where he gained experience as a medical/sales representative in Ibadan. At Babcock University Teaching Hospital, Ibadan Annex, Ibadan. Mr. Adekunle worked as medical laboratory scientist/laboratory manager. He also served Leeds City University, Ibadan, at the Faculty Department of Medical Laboratory Science and Basic Medical Sciences. As a man of endless resources, Mr. Adekunle founded Predan LLC and is currently the founder/the CEO, Predan and Project Lead Screened. He also has a position at Pine Biotech Incorporated, USA, as Program Director, Omics Logic Africa. MLS Adekunle, whose hobbies are problem solving, teaching, whose extracurricular includes blood donation exercises, nothing less is expected, for his passion shines through in his paper on Tele-diagnosis and laboratory information management system in clinical laboratory practice. Please welcome with me MLS Adekunle Oluwatosin Adeluwoye. Thank you.
Good afternoon, everyone. I want to thank you for that citation. It was very much unexpected, but I want to start this afternoon by standing on existing protocol and acknowledging the facilitators that have gone ahead of me, as well as all the leaders and elders in the profession that are here present. Good afternoon, everyone. So this afternoon, I'll be speaking on this topic, Tele-diagnosis and laboratory information management system in clinical laboratory practice. And I'd like to acknowledge my presence here, being associated to these various bodies, starting from Association of Medical Laboratory Science of Nigeria, as well as Leeds City University, where I currently work as a faculty, and also to Pre-Dian. Pre-Dian is my own pet project, which I hope to be able to share a little about, as well as being a member of Digital Health Nigeria. I think I have only one co-member in this whole entire hall, but it is my desire that after this presentation, we have more people also being part of that. All right. I would like to move on now. During the course of this presentation, I'll be guided by this outline. I will try to introduce the topic, talk about the concept of telehealth, and from there we'll move on to talking about tele-diagnosis. We take a look again at laboratory information management system and move on until we get to contextual issues and conclusion. Like the speaker before me said, laboratory environment is a very, very high-tech environment globally. However, a wide variety of technologies, of course, and tools, are involved in the diagnostic processes. But my focus this afternoon will be on the discourse that centers around health information technology, which I'll call health IT tools, okay? Of which both the LIMS and the tele-diagnosis I'll be talking about are a component of. Health IT covers a broad range of technologies that is used in healthcare, and it includes the electronic health records, which is, I would say, the commonest among them. Then we have clinical decision support, patient engagement tools, computerized provider order entry, laboratory and medical imaging information systems, and also health information exchanges, as well as medical devices. So health IT plays critical roles when it comes to the various aspects of diagnostic process. And this, of course, includes capturing information about a patient that informs the diagnostic process, and as well as clinical history and interview. I mean, when we use the normal request form, there is a role or a place for getting the provisional diagnosis. Of course, this also moves on to the physical examination, diagnostic testing results, and all other workflows that also shapes the clinician's decision process. So all of these are captured within the health IT technology or tools that I'll be talking about this afternoon. Quickly, I'd like to start by talking about the concept of telehealth and telemedicine. Telehealth is a spectrum of services, but generally, it involves some degree of telepresence. And when we talk about telepresence, we are talking about video, teleconferencing. It also includes remote diagnostic equipment or centers, as well as telemetry. And all of these enhances the ability of the healthcare facilities to provide diagnosis at a remote site. And so if you see the image I have here on the screen, you can see the various categories of tele-based services. We have the tele-diagnosis, which is one of the components of telehealth generally. We have telepsychiatry, we have teleconsultation, which generally people refer to as telemedicine. We have telenursing. So it means you can actually provide nursing care to someone at a remote site. You may begin to wonder, how is that possible? Of course, nurses have the most contact with patients, but today there is also what we call telenursing. There's tele-rehabilitation, telemedication, as well as tele-treatment. And we cannot take away the tele-education and awareness also. So telehealth essentially refers to the infrastructures as well as the non-clinical services in support of delivering remote health care. Okay? And definitely this rides on technological platforms as well as public health substructures and healthcare administration. So in a nutshell, telemedicine uses modern ICTs to provide healthcare services to remotely residing public and patients, clients or users. Then what is telediagnosis? Telediagnosis, simply put, is a medical diagnosis made by means of telemedicine. Remember, I said it's one of the core components of telemedicine. And the term telediagnosis itself refers to remote diagnosis. Tele there means remote, while prefix the suffix to it, which is diagnosis, of course, is our primary area of focus. It is the determination of a disease at site that is remote from the patient based on transmitted data. I like to emphasize that when we talk about remote diagnosis, it oftentimes still requires, personnel with certain skills. Okay, I know some of the things. Some people might be thinking does that mean people begins to use the laboratory without the need for me as a laboratory scientist? No, that is not what we are talking about. Okay, but even today, when we are even carrying out this telediagnosis, oftentimes it requires, the service of experts and skilled personnel to be at the other end where the patient is. Today, you now see what we call home-based testing. People go to the location of the client to collect their samples, and possibly they are not the one that will bring it. They just simply deliver at a logistics center, and the sample arrives at your laboratory. You process it, and the result gets back to the user or to the patient. Quickly, I'd like to look at laboratory information management system. I know many of us were aware about this. A laboratory information management system is a software that allows you to effectively manage samples and associated data to improve lab efficiency. And LIMS, for short, is a suite of technological software. You see, when I mentioned earlier on, both of them are a component of health information technology. That is LIMS as well as telediagnosis. And what does it do? It allows us to effectively manage samples and associated data to improve the entire lab efficiency. Also, it helps us to automate workflows, integrate instruments, and manage samples and associated information. For laboratories that are using LIMS, oftentimes, especially when they have automated system, you see all of these automated machines connected to their LIMS and, with the LIMS package, you can actually know the state of many of those instruments and their data that are being generated. The results are all integrated and delivered to the system. Similarly, it helps us to produce accurate, reproducible results, oftentimes faster and more reliably. It makes data for sequencing runs easier to store, track, and assess over time and across experiments. And of course, it helps evaluate and improve operational efficiency. So, why choosing or considering LIMS? Okay, there are certain characteristics, features, of course, that comes to mind. One is sample tracking, instrument integration, integrated barcoding, integrated quality assurance and QC functions. All of these, of course, from previous presentations, we recognize the importance of all these features in our laboratory or diagnostic processes. Also, we can do query searching, powerful reporting functionalities, audit trace, and also enterprise system integration. So by using a LIMS, a clinical laboratory can automate workflows and integrate their instrument, manage samples, as well as associated information seamlessly. So functionality of LIMS, I'll just run through these. They are divided into 5 laboratory processing phases. Of course, the reception aspect and logging in of samples. We also have the assignment, scheduling, and tracking, the processing and quality control associated with that sample, the storage of data that are generated from the processes, the analytic phase, as well as the inspection, approval, and compilation of sample data for reporting. Of course, we heard the speaker who spoke about quality assurance, talking about the importance of each results being verified and before approved before they are being sent out. So back to talking about telehealth now as a component of health information technology. Right, the terms telehealth, telemedicine, and e-health are often used interchangeably. All right, but basically they represent telecommunication used for healthcare purpose. Although technology has, evolved greatly in recent times. Before now, it used to be telephone services. I remember while working as, laboratory manager at Babcock, there are several times I'll place a call through to Total Healthcare, okay? At times, because we needed prompt, release of the result. Maybe the patients we are managing, we needed the results to get back to them, on time. So we do that via phone. But today, many of these, consultation and services has gone beyond just mere phone calls. So, of course, this definition is agnostic to the specific technologies that is being used, meaning it does not, is not confined to the technology that is being used. So, telehealth, I must say this, has been at the adolescent stage for decades. It has always been there, particularly LIMS. Of course, I think I got to know about LIMS right from school, while I was in school, and that is about more than a decade ago. Okay? So, but the COVID-19 pandemic that took place, that happened, is one of the things that has helped in advancing telehealth generally. Okay? And that is one of the silver lining from that pandemic. So today we see that a lot of activities happens remotely, and results, the turnaround time is well improved, and riding on health IT. So why then do we have to consider health IT in clinical laboratory practice? The increasing complexity of healthcare has required healthcare professionals to know and apply vast amounts of information, and of course these demands is well, overweighing, the human cognitive capacity that these professionals possess, and contributes a lot of challenges to the diagnostic process. And in particular, by supporting individuals involved in diagnostic process and tasks they perform, health IT can improve diagnostic performance very significantly and reduce the potential for diagnostic errors. This author, Ekare et al., asserted that unaided clinicians, they actually refer to clinicians, but this is applicable to all healthcare professionals. They often make diagnostic errors because they are vulnerable to fallible human memory, variable disease presentation, clinical disease processes that are plagued by communication lapses, and a series of well-documented heuristics, biases, and disease-specific pitfalls. What they are saying essentially is, with loads of information we have to process, nowadays, all right, especially with the use of these automated systems. Okay, many of us, while we were in school, were not, all that is needed to do is to prepare your slide, put it under the microscope, and view it, and give a report. At best, when you are not so sure, you call a colleague to come and check the same slide and give a second opinion. But of course, this is changing now. All right, with Tele-diagnosis, all you needed to do is to prepare the same slide with your smartphone, capture, you can see the microscope is totally bypassed, and through web transfer, it is transferred to either a local server or to a central server, where either using artificial intelligence or some other information technology softwares, results can be provided and sent back to you. Okay? Or in another case, we have situations where when this is captured and sent across, we have multiple experts, okay, at various locations, also providing, based on the captured image, providing their opinions. And of course, rather than just 2 or 3 in my individual laboratory, I might have up to 50, 30, 20 persons reporting on that same slide. And apparently you agree with me, the results, the accuracy will be improved. So the merits include decreased costs, increased access to general medicine and preventive care. Of course, before now, without a doctor giving you a prescription, request form, you can barely enter most of our laboratories. All right, but with Tele-diagnosis, you can actually access just any test on your own. The patients can access this test, including specialized testing. And also we have quicker time to diagnosis and increased patient and provider safety when dealing with infectious disease outbreaks. Now, telehealth as a patient-centric care approach. All right, consumer-directed medicine is fast evolving. And in fact, consumers, or let me say patients, are increasingly taking ownership of their health. Gone are the days when they have to, of course, we are talking about preventive care, where they have to force it before they access the healthcare services or laboratory. So this trend is increasingly affecting tele-diagnosis today, as well as telemedicine generally. You now see trends like virtual medical visits, okay, direct access to laboratory testing, like I mentioned. We have app or web-enabled ancillary services and appointments. You can schedule your appointments to visit the laboratory. We have test results availability via the app or the web, as well as remote specimen collection. And of course, these trends have now been, disrupted and perhaps very much accelerated by the advent of COVID-19 pandemic. In fact, during the pandemic and up to now, in some instances, visits to healthcare services, change from 100% in person to almost 100% online, okay, with little percentage requiring visits. I'd like to drive home this point by talking about sharing our experience with Pre-Dian. So Pre-Dian was designed as a platform for users on-demand access to diagnostic care. What is that word, on-demand? On-demand means they demand it as demanded by them. Of course, it helps us to provide services, at convenience to the users or patients, at their own stipulated time and, terms. And of course, the problems we identified, why we wanted to start this was, number one, the lab use complexities, okay? Usually when people come around the laboratories, they usually do not have, this wow experience they live with. Some of them, once they have, any day they are going to the clinic and they have to use the laboratory, they know that, today I'm in for it. Unfortunately, we do not even make it as professionals. We do not make it quite a friendly encounter for them. Remember, we have little experience or encounter with these patients. The doctors have most of it. I was telling someone, if we were to have issues, healthcare system is, there are a lot of interprofessional rivalries there. Many times, even when we are on the right side or we are seeing certain things that are quite germane, you notice that the public often stand aloof. They are quiet because they are closer to the doctors. They are more friendly. They know them more closely than us. We often walk behind the scene. All right, they don't see us. And the only few times they have to interact with us is when they come for maybe sample collection and the rest. And unfortunately, we make it a hell for them. That's unfortunate. So if they are to vote or to take side, they will likely not take our side, despite that we are right and we are fighting for their interest. Okay, so there's a lot of lab use complexities. Accessibility also is an issue. A lot of people cannot access a test once they do not have a request form. So there are people who are interested in coming to our laboratories, but because they feel like, what do I tell them there? Okay, what do I tell them I want to do? They don't know what to do. But unfortunately, many of them today, Google is their number one consultant. Okay, but after seeing what Google is saying, they don't know what to do next. All right, so accessibility, once there's no a physician or someone directing them, is an issue. Of course, access to specialized testing is also an issue. And we needed to move away from the old practices in the digital era. We're in the digital era where everything happens on the phone. You can perform all of your, you can stay 6 months not visiting the bank, not visiting your utility providers, and you are enjoying all of these services. So why not also bring diagnostic care, to them there? And of course, we came up with a solution, an on-demand access to lab tests, as close as their mobile devices, with good lab use experience, fast test result delivery, and other value adds. So these are essentially what we are trying to provide. And you can see there, we also provide anywhere access to reports. Many of us, of course, there are test results I remember that I had, is still in my wardrobe or whatever, of my medical checkup, medical screening when I was entering university then, but I can barely go around with it. But with such services like this, if I find myself in UK today, all I need to do is just to access my portal and I can bring out all the history, all the previous diagnostic results that is available. Of course, there's also personal dashboard with analytics for additional insight. And you notice also one of the challenges our clients, our users, our patients have is making a meaning of these test results. They just see, let's even assume it is typed or well written. So maybe 125 milligram per DL. Many of them cannot make a meaning out of it. Well, let me take it to the client. But we need to just move an extra layer to ensure they have good understanding of what they have paid for. These are some of the key impacts: prompt care, stakeholders, ease and convenience, improved access and seamless lab use experience. And I like to share that this is one of the result dashboard. This patient has ordered fasting blood sugar and glycated hemoglobin. The result has come out, 1058.6, okay? But you can make a meaning at least. You can see pictorially that one is in the red zone, whereas the other is in the green zone, okay? So these are ways we can make them have additional value for what they have paid for. And of course, there's ability to also compare several results graphically down there. Of course, we had a number of recognition for this, and Pre-Dian is not the only one. Even in Nigeria today, we have Health Tracker, okay, is another diagnostic laboratory solution or tele-diagnosis provider. We have My Labs. Digital pathology is currently not in Nigeria, but is fast expanding. And the other one there is Crane, is launching very soon. I happen to be part of it also. So what are the benefits of tele-diagnosis as I quickly move towards the end? Wider reach of service list. Okay, as to patients, if I were to be visiting just like I remember talking, the first presentation today was talking about, oh, you do not have access to this service, you have to, but this client has come to you, maybe, he has been coming there, and so you needed to use that laboratory, and so the patient, what happens at the laboratory's end is that they send the result out. There was a debate around whether you should put it on your form or so. But for users, they can access all the tests. It might not be at the same diagnostic center or laboratory, okay, but it gives them wider reach of service list. Unlike when they come and they say, I want to do blood group, I want to do urinalysis, I want to do ANA, anti-nuclear antibody test. And you say, oh, my lab doesn't have that. But if they are accessing these tests via the online platform or tele-diagnosis, they have the choices to choose. And so it gives them wider reach of service list, lower cost, of course, improve access to care, patient preventive care. Many of them are able to just order these tests to do checkup. And it means more revenue actually to our laboratory. Convenience, of course, and of course, it slows the spread of infection, especially in this age of COVID-19 where we needed to keep distance. Then tele-diagnosis also benefit healthcare providers. It benefits us as laboratories. Additional revenue stream. If your laboratory is located on Bodija Oje Express Road, of course, it's limited to that catchment area. But with presence on a tele-diagnosis platform, it means people beyond that environment can access your services, and it will also benefit you. Of course, increase patient and physician satisfaction because everybody wants a faster turnaround time, reduce overhead, less exposure to illness. There are drawbacks also. So the patient insurance coverage is an issue. Protecting their medical data. Yes, this is a very important. So everybody is careful about their medical data. And so you want to be careful of the tele-diagnosis platform you are using, which is where as professionals or as laboratory providers, we needed to pay attention. And of course, care delays. There are certain diagnostic procedures you cannot immediately carry out on this platform. Healthcare providers also have their own drawbacks. Technological concerns, you want to worry about internet and some other issues, as well as inability to examine the patient. There are still some conditions you needed to see the patient. That gives you a lot of information about what is happening to this patient. Okay, I remember there was a time I ran a test. Thank God I saw that patient. Okay, and I just saw a potassium value of 2.4. I was all like, something is wrong. So it gave me an opportunity to start looking inward. What could have happened within my system? And of course, I discovered it was the reagent that had issue. All right, of course, licensing issues in some environment. Quickly, this is one area I'd like to talk more, contextual issues. All right, so telehealth compliant clinical laboratories and practice is one of it. There was a time, I think maybe in the early 2000s, everybody, I want to be computer literate, I want to be computer compliant, okay? For people who were already working, I remember back then in UCH, who were still students then, so you see many of them going back for retraining, maybe when they close 4 o'clock, they go somewhere to go and learn about computer and all of that. It is high time, and I think that is also applying to our laboratories today. Is your laboratory telehealth compliant? Okay, otherwise, of course, you will be. If you are not taking steps at this point in time, you notice in a matter of years from now, you'll no longer be in play. You'll be irrelevant. Also, as professionals, are you telehealth compliant? Okay. we might find ourselves working in private centers, which of course is more prominent. But even for us in public laboratories, government laboratories, we should not fold our hands. Okay, I remember prior to the COVID-19, I was privileged to know about a discussion around telehealth or telemedicine in Oyo State. The current governor was about adopting it, and I was part of those who went to give some presentation on it. Incidentally, it was similar to what was being discussed. When the discussion was going on, no lab, no, but they will just implement it. You just notice, and these conversations is happening. There are a lot of people who have access. In fact, most of the current startups, they have access to our governors and all of that than you can ever imagine. All right, and they will adopt it, and then like Ekiti State now is highly telehealth compliant state. So if you are working with government and suddenly you just notice that you are out of circulation, it becomes an issue. Also, the current wave of e-health or telehealth, there are lessons from us from the lab automation era. I remember very well, I was still in school, 200 level, 300 level. Most of the discussion there was, will automation take our jobs? And people were, no, yes, and all of that. But beyond the argument, a lot of our laboratories did not take any action, which is why many of them are out of businesses today. I remember when I was in my first posting in clinical chemistry laboratory, they used to send some tests to some labs in Yemetu. I doubt if that happens again. They cannot play, in that space anymore. Many of them did not. I remember, I even know a laboratory currently that still use this Bonvita thing. In fact, the person working there told me they use a lamp atupa. I was like, atupa, not even lamp. Okay, it's here in this Ibadan. You know them. So apparently they were not changing. They were feeling we are still making the money. Same thing, if we are not paying attention to telehealth today, either as private laboratories or public laboratories, a time is coming, we just notice that the 54 genes, 7 rivers, clinic lancet, total care, of course, they take all of the markets from us. So that is another area of competition which we should pay attention to. Of course, like I said earlier on, digital health stakeholders, there's a lot of gaps there. Like I mentioned, in that group, I think I'm aware of at least 2 of also our medical laboratory scientists on that group, myself and Mr. Olorunlano. And a lot of discussion happens there, engagement with government, what is happening, digital health, telehealth, those who have raised funds, all manner of discussions, okay? Unfortunately, we are too few. We want more medical lab scientists there. And what does it qualify to be there? Just be digital health compliant, be a founder, you too. Show interest, and then you join the stakeholders. If tomorrow they want to say, we want a committee that wants to engage with, they are talking about bees happening in the National Assembly. A lot of things happening in that network, in that platform. But what is painful to me is that we are too few. We are in Wakere, we cannot match up. Many times we try to defend the laboratory. Incidentally, there are many players in the diagnostics who are not laboratorians, who are also there. And oftentimes they take it on our council. But of course, we try to fight that. But the bottom line is we need more of us to pay attention to digital health. And it doesn't take us knowing how to code. Of course, I tried learning how to code, but I noticed I can't cope with that trend. Okay, I only needed to just pay those who know how to code. You can found the next Facebook without knowing how to write a simple code. What matters is your interest and your inventiveness. And of course, there's need for us to also keep abreast of current technologies. We are talking about artificial intelligence. It has eaten deep into radiology services and medical lab science. In fact, there are a lot of works, researches going on where people just take a slide, put it into the machine will tell you this one is positive, and this is even what will happen to the person. It will tell you a lot of things. We need to start paying attention. And in fact, lastly, metaverse. Metaverse is another thing currently. Please, I'm mentioning this so that we can go and pay attention. Metaverse is where it's more like doing social networking, Facebook, but with a kind of video or image. Meaning, if I'm a member of Metaverse now, I will have my own avatar, I can decide I want to use a cartoon to represent me. If I do like this, that thing will also do like that. So I can communicate with you over there. I can say, oh, patient, how are you feeling? So I begin to see the patient, although I'm seeing, not the patient video-wise now, but I'm seeing some, kind of cartoonize, whatever. I don't know how that technology works, but it is looking more and more